Hi there and welcome. This video is for the person who is currently or recently dealt with knee pain. My name is Andrew Zhang. I'm the owner of Zhang Physical Therapy, and I help people stay off pain medication, avoid injections, avoid surgeries, and above all, stay out of doctor's offices. So what I'd like to do over the next few minutes is hopefully answer a few questions that you may be having regarding your knee pain and what may be done to help you feel better. So one of the most common questions that I hear from people with knee pain, and I hear it frequently, is I just visited my doctor or orthopedic and they said my x-ray looks horrible and I either currently need a knee replacement or am going to need a knee replacement in the future. And the doctor, they're treating you based off of your x-ray or your image, and people like myself, we treat people based on what they are unable to do, be it climb up and down stairs, get out of a chair easily. They wake up and they have morning stiffness for 25-40 minutes. And these things are all common for people who may have some knee arthritis. And all arthritis really is age-related changes. People hear arthritis and they think the worst. If you have enough birthdays, you're going to get arthritis. If you're over the age of 40 and they take a picture of your knee or any joint in your body, it's going to show signs of age-related changes, wear and tear. Now, some people may show these changes more significantly based on their occupation or what they did for recreation, and some people it may be genetics. But just because your x-ray or image may not look the prettiest doesn't mean that there aren't things that can be done. You know, like I said, doctors treat off images. Therapists like myself, we treat function. So what can't you do? So when people come into my office, they tell me they list out everything they can't do. And we try to set about to see if we can make those changes. And in the majority of times, we can make a difference in terms of not only their function, but in terms of the pain that they live with on a daily basis. And for a large percentage of people, if they can live with a little bit less pain and improve their function, they're quite happy to avoid knee replacements. There's one gentleman that I met for the first time probably 8 years ago. He came after a meniscal surgery cleanup, and his big goal was, how long can I stave off having a knee replacement? And as of last year, he was still living with his knee, hasn't had his knee replaced. We've had to do some tune-ups periodically to get him back on his good exercise program and whatnot, but he's still going strong 8 years after our initial encounter, 8 years after a doctor said he needed a knee replacement. So it is possible for any of you listening. Another common question that I get from people is, the doctor said I have a meniscus tear and I need surgery. And that may be the old way of thinking, because more and more literature is being published on a monthly basis showing that rehab is equivalent to surgery. So what this means is, if we take 100 patients and 50 of them just have rehab, 50 of them undergo surgery, after 1 year, those groups are going to look the same in terms of pain and function. So what this tells me is, or makes me question is, why is anybody going to have surgery on their knee and risk infection and deal with increased surgical pain, maybe have to walk with crutches for a period of time because it hurts, only to end up in the exact same place 1 year down the road? Oh, and by the way, those people who had surgery, they had to undergo rehab post-surgery anyway. So why not give rehab a chance on the front end? That way you don't need to have surgery in the first place. Another common question that I get is, is what I'm experiencing just related to age? And I don't like that excuse, and I don't let my clients use that as an excuse, because I've worked with plenty of individuals in their 70s and 80s, even into their 90s, who remain active. I saw a great video online, you can look it up. There was a 100-year-old woman who ran a 100-meter dash at the Penn Relays. So clearly you can be active as you age. Many factors go into how a body's muscles and joints age over time, but the best way to keep yourself active and mobile and keeping those joints young is by activity. So it's what you do in your 30s and 40s that impacts how you're going to feel when you're 50, 60, 70, or beyond. So if your goal is to live past 40, which most people watching this video are probably over that age, doing activity is probably a good thing. It's not that you have to go to the gym and work out an hour every day. It's not that you have to go run or cycle or do anything specific. It's just finding some activity that you enjoy, be it yoga, be it Pilates, be it swimming. It could be running, it could be walking. Any kind of physical activity is good for your muscles and joints, along with many other health benefits that you get from them. So, if you're out there living with knee pain, you have questions, you have concerns, you're not happy with, your current level of function in terms of being able to do simple household chores, work out in the yard, exercise, play with kids or grandkids, please, let's have a conversation. Let's begin to troubleshoot problems that you may be having and attempt to find a solution that's going to work for you that doesn't involve you taking 800 milligrams of ibuprofen or Aleve every day, that doesn't involve injections on a routinely basis, that doesn't involve you going under the knife and having holes or an incision put in your knee unnecessarily. So if you're somebody who wants to be more active, be more mobile, be independent, and continue to be that way for years to come, again, let's have a conversation. I love to talk with you and help you to get back to enjoying the things that you love doing. Again, my name is Andrew. Zhang Physical Therapy is my practice, and I look forward to helping you. One more thing, if you are looking for more information, you can click on the free information booklet right next to this video. And if you do have any other more specific questions, there's a phone number right above this video that gets you in direct contact with me so that we can help you with your problems. Alrighty, I hope you have a nice day, and I hope this answers some of your questions.